Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer here at the Global Healthy Living Foundation. For those that don't know me, I lead advocacy and policy here at GHLF. I'm a lawyer by training, a professor, and also someone living the system alongside you. My job every day is to take what's happening in Washington and around the country and translate it into what it actually means for patients. And sometimes, what it means isn't obvious until it's already affecting you. Before we get into it, I want to ground this in something real. Last week, I heard from a woman in our community. Let's call her Mary. She has a chronic condition, she relies on Medicaid, and she said to me, "I don't follow policy, but I can feel something changing." That's what today is about. Because policy doesn't stay in Washington. It shows up in your life. Today, we're talking about the federal budget and why this moment is different. Because this is no longer just about proposals. We're already seeing real-world impact. So today, we're going to connect the dots. What the new proposed budget includes, what has already changed on the ground, and what this means for patients right now. Let's start with the proposal. At a high level, the Trump administration is proposing a 12.5% reduction in discretionary spending for the Department of Health and Human Services. That would bring HHS funding down to about $111 billion compared to roughly $125 billion today. This is not as steep as what was proposed last year, but it is still significant. And like all budget proposals, it tells us something important: what is being prioritized and what is not. So what does that actually mean? It means fewer resources behind the scenes that help keep people stable before they ever show up in a doctor's office. One of the biggest structural changes is the creation of a new entity called the Administration for a Healthy America, or AHA. The goal is to consolidate programs across the CDC, HRSA, and SAMHSA. The administration says this will reduce duplication and save about $5 billion. But consolidation also often means elimination. Programs tied to chronic disease, mental health, and community-based public health could be reduced or disappear entirely. So while the language focuses on efficiency, the impact is a redefinition of what public health priorities look like. Additionally, there are pending cuts to research in this proposal. This proposal includes $5 billion in cuts to the National Institute of Health, NIH, which is about a 10% reduction. NIH funds the pipeline that leads to new treatments and long-term medical progress. Several institutes are also on the chopping block, including those focused on minority health and global research. Here's the translation: fewer shots on goal for the treatments patients are waiting for. These cuts don't show up tomorrow, but over time, they shape what medicine looks like in the next decade. The budget also proposes reducing funding for public health infrastructure, including preparedness programs, emergency response systems, and hospital readiness programs. These are the systems you don't think about until you need them, and by then, it's too late to rebuild them. Several programs that directly impact access to care are also targeted, including family planning services, child health programs, community services, and energy assistance. These may not sound like healthcare programs per se, but they are deeply connected to health. When they go away, patients feel it through reduced access, increased financial stress, and worse outcomes over time. So where's funding actually increasing in this budget? Well, there are increases in the health budget in areas such as food safety, environmental health, artificial intelligence, and some telehealth. These reflect a shift in priorities for the administration, but they exist, of course, alongside the broader reductions elsewhere. Now, here's the critical point. What is already happening? This is not what's proposed in a budget, but what is actually happening on the ground. We are not starting from zero here. Last year's legislation already reduced Medicaid funding by about $665 billion over the next decade, and the effects are already showing up. States are tightening eligibility, adding work requirements, reducing enrollment. The result is that an estimated 7.6 million fewer people are going to be enrolled on Medicaid over time. If you're listening and you rely on Medicaid, or might one day rely on Medicaid, this is where it becomes personal. This is about whether you still qualify, whether your benefits change, whether your doctor still takes your plan. This is not theoretical. This is practical. If any part of this is hitting close to home, raise your hand. Go to ghlf.org and sign up for our free newsletter. We break this down in plain language and tell you exactly what's changing and what to watch for. You don't need to follow policy every day. That's our job, but you should know when it affects you. Okay, stepping back to the proposed budget, there is a broader shift that's happening. The federal government is reducing its role and shifting more responsibility to the states. In theory, that creates flexibility for health plans. In practice, it creates variability across the healthcare ecosystem. Some states will be able to absorb these changes, others won't, which means where you live will increasingly determine the care that you get. So what does this mean for patients? What should you take away? First, this is a moment of transition in our healthcare. Second, access is becoming more uneven across the country. Third, as always, advocacy matters. The reason deeper cuts didn't happen last year is because people spoke up, and that will matter again. We need your voices to fight these pending cuts to our healthcare ecosystem. Budgets are where priorities become real, and right now, we're watching decisions that will shape who gets access to care and who doesn't. So if you take one thing from today, it's this. Pay attention when things feel like they're changing, because they are, and you don't have to navigate it alone. If you want to go a step further, join us at the50statenetwork.org. It's free, it's patient-driven, and it's how thousands of people across the country are making sure their voices are heard. Because at the end of the day, health policy isn't about numbers, it's about people. Thanks for listening to The Health Advocates. If this episode helped you understand what's happening, share it with someone who needs it. And don't forget to sign up at ghlf.org to stay informed. I'm Stephen Newmark, and we'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.